layperson or undergraduate level student will understand the unique material contained in this book. So no experience needed to absorb and get the greater understanding of the field of psychology and clinical practice. So without any further ado, let me bring our author up to the podium. Thank you.
Yes, I want to celebrate and acknowledge all of you for coming and let you know how much I appreciate you celebrating, this moment with me. It's my patients that have taught me the lessons and taught me the abundant lessons of my strengths and my weaknesses. So it is to them that I could write this book and that I could write these guidelines after 40 years. She said 20, but no. I'm not that young. So it's really been my patients that have educated me. There are 2 special chapters, and there are appendices for therapists. And those appendices are charts, forms, everything I've used for my practice that can be downloaded. The chapters are in your table of contents. One is chapter 16, and it's progression into trauma. This is like the deep work of trauma that you don't do until you've done the character analysis. After you kind of peel off the outer layers of our defensive structure, people then can feel and they're ready to go into trauma. As I teach my students and professionals, don't go into trauma early, or you absolutely get in over your head and the patient isn't ready, and then it's all up in their head story. Chapter 17 is on dream analysis and individuation. This is Jungian dream analysis, archetypes, collective unconscious, alchemy. I mean, it's like one pebble on the sand of Jung's work, but it is a pebble, and it will be helpful for dream analysis for patients and therapists to read, to see what really goes on in a dream. And I'm going to give a dream and an interpretation today in an excerpt. And I believe my writing speaks to my passion on the subject. So take some breaths so that you oxygenate, because when you slide up to your head, sometimes you can't come down. And you get kind of bored, potentially. So keep yourself alive through this. Psychotherapy is a heartfelt and soulful work. It is a profession fraught with shadowy times as well as sweet successes that feel warmly satisfying. It is also a profession that grows us up from within as we hold the impossible while trying to metabolize unthinkable situations, the contorted distortions of human life. Relationships are created that dig as deep as the old, dank, gnarled roots of a tree. Our patients know us as they learn how to know themselves more and more. These therapeutic relationships develop over time and have their fair share of conflicts, disappointments, and potential ruptures that may bring the existence of the relationship to the edge of the abyss. Who knew when therapy began where it would wind its way? Therapeutic relationships have a life of their own. The therapist, in the process of learning to be effective, matures, settles, and becomes whole in the process of good work. The patient also is demanded to grow, to stretch far beyond what he thought was possible, entering dark terrain and coming out the other side. He too becomes whole. Therapy moves beyond personal history and pathology to become an opportunity for transformation and individuation. Thus, therapy engenders the archetype of the mandala, as both therapist and patient achieve wholeness through the rigors of the process. I also updated Reich's approach to include the concept of gender fluidity and encourage less patriarchal attitudes. One of the most important tenets of this guidebook is to know and understand your patient. This does not mean know her story, nor does it mean know her problematic symptoms. It means delineate the basic structure of how the patient is. Then you have a roadmap that can address that particular structure in a systematic way. A major tenet of Jung's analytic psychology is individuation. Like Reich and Masterson, the journey to the self is the goal of their therapies. Reich, Masterson, and Jung have slightly different terms for one's authentic essence. Masterson called it the self, Reich the core, and Jung the individuated self. The commonality is that their therapies direct the individual to discover his authentic self, rather than rely on the facade or the false self. Dreams become a gateway toward the individuated self as one's internal objective psyche, critical term of Jung, objective psyche, can be seen as the guide. Jung's compilation of dream symbolism is of critical importance to any therapist doing dream work. On to the excerpt. What is a dream? The patient can be disoriented by the nonsensical quality when first recounting a dream, as there's a minimal coherence in the parade of images. There are elements that may shame and embarrass the patient, such as risque sexual behaviors, elaborations on human functions, like pooping in an overflowing toilet. If you haven't done your own work, you are not able to metabolize anything you're giving to the patient. You're asking them to strip down when you haven't done that stripping down, and you are, not in treatment, so you're not able to, you've got the fear of patients, you've got your own narcissism, you've got many things that if that isn't cleared out of you, you can't, in my opinion, do good work. I mean, and I say it in the book repeatedly, get your own therapy and consistently be in therapy so that it really works. And patients will recognize when therapists are off because something will be wrong with the picture, and patients should listen to that. And sometimes it's their own negativity. So that's the balance.